Very good evening to the esteemed audience of Gyan Pravah, the podcast series of Fogsi. Welcome to the episode 33rd and the second episode hosted by the Clinical Research Committee of Fogsi under the dynamic and visionary leadership of Dr. Sunita Tandulwadkar, President Fogsi 2025. I am Professor Dr. Surekha Taide, Chairperson of the Clinical Research Committee Fogsi and your host for today. It is my privilege to welcome our distinguished guest, Dr. Janvi Nilikani, Founder Director of Astrika Foundation and Astrika Midwifery Center, a trailblazer in maternal health care and a passionate advocate for respectful and evidence-based childbirth. Today's discussion is on a topic of immense importance: empowering women's choices for childbirth. Welcome, Dr. Nilikani.
Thank you so much. Thank you. Thank you for having me, Dr.
I would also like to welcome our very own President Fogsi, Dr. Sunita Tandulwadkar, an iron-willed leader, a visionary, and a force of innovation. Dr. Sunita Tandulwadkar doesn't just lead, she inspires and transforms. With every initiative she takes, she uplifts those around her, empowering them to become leaders in their own right. Her revolutionary Gyan Pravah series, a daily podcast that has completed a month, has turned 30 committee chairs into confident voices, each shaping the future of gynecology. The Eagle Project, a groundbreaking national initiative, is training every gynecologist in endoscopy, ensuring that expertise in minimal invasive surgery becomes a standard, not a privilege. Arogya Yogyatra, Dodi Ke Zindagi Ke, and Sampurna are other trailblazing projects set to revolutionize women's healthcare in the nation. Dr. Tandulwadkar leads by example. As a globally acclaimed IVF specialist and endoscopic surgeon, she has refined and redefined infertility treatment in India. She has pioneered advancements that once seemed impossible, whether delivering India's first stem cell baby or steering Fogsi into an era of inclusivity, mentorship, and cutting-edge science. Beyond clinical excellence, her academic contributions have left an indelible mark. Author of 18 books, over 85 publications, she is the editor-in-chief of Indian Journal of Gynecological Endoscopy and esteemed reviewer of the Journal of Human Reproductive Science. Her expertise has been sought after at over 400 national and international conferences and several orations, in fact, daily orations, where we have shaped discourse and mentored countless professionals. Her leadership is not only about holding power, it is about creating power in others. Often she says, true leadership is not about being in charge, but about taking charge of creating more leaders. Dr. Tandulwadkar, we are honored, ma'am, to have you with us. May I request you to deliver the welcome address?
Thank you, Surekha. Thank you for beautifully crafted words of appreciation. It really touched me. Friends, this podcast series, now second inning is going on, and the way all committee chairpersons are working, the way they are taking the podcast to another level with their dialogues, the way they are interacting, coming out with the fantastic, it may be academic, or it may be psychological, philosophical, spiritual, or maybe today we are with Janvi, such a young leader, and she's going to teach us, you know what, the way we live life, the way we look at the life, the way we have our principles in life, they evolve as we grow or as we hear many more young leaders as well. Thank you, Surekha. Thank you for selecting such a fantastic faculty. And Janviji, it will be wonderful to listen to this podcast. Surekha is one of my most dynamic leader, and I feel it's not that I'm giving them a platform. They deserve this platform. It is their right that they get because they work very, very hard. Ultimately, we all work for the organization selflessly. We take out our time, time from our profession, time from our family time, or our me time. We just devote it for a Fogsi. Their time has to be valued, and we respect you, we love you, and we look at you as one of the leader of Fogsi one day. The day is not far away because you all are very dynamic. Thank you, Surekha. Thank you for making Gyan Pravah as one of the best podcasts. Janvi ji, after your introduction, probably I'll leave so that in the podcast, it will be the dialogue between the two leaders. Thank you.
Thank you very much, ma'am. You're so very inspiring, and we really appreciate you. You have made a little space for us from your very important operation theater. So that shows your dedication to the cause and your devotion. Thank you so very much. Now, let me introduce Dr. Janvi Nilekani to the house. Janvi is an applied microeconomist, a women's empowerment activist, a health systems reformer, an effective philanthropist, a mother, a partner, a daughter, and much more. She now works in the field of maternal health. Janvi is a 2018 alumni of Harvard, where she completed her PhD in public policy and holds a 2010 BA Cum Laude in economics and international studies from Yale. Janvi's personal experience with childbirth in India left her feeling a little disappointed, disempowered in the current birthing process. It brought to light the minimal standards of maternal care in the country and deeply inspired Janvi to bring about some change. Coming from a well-respected, socially minded family of entrepreneurs, Janvi founded the Astrika Foundation, an initiative of Nilekani Philanthropies, in 2019. At Astrika Foundation, she uses a background in academic research, public policy, and public health, and strives for India-wide improvement in the quality of maternal health care. Janvi founded the Astrika Midwifery Center in 2021, which is an interdisciplinary birth center in Bangalore. AMC provides ethical, evidence-based care and respectful and informed shared decision-making. Her team supports mother through every stage of their journey into motherhood. Welcome, Dr. Nilekani.
Thank you so much, Professor Surekha, for having me.
Now let us begin this engaging discourse on empowering women's choices for childbirth. I would like to thank ma'am for joining us.
Thank you, Surekha.
Yes.
Thank you. I'll enjoy your podcast from another link. And Janvi ji, it was wonderful to know you, and at such a young age, doing so much of philanthropic work. Thank you.
Thank you, Dr. Namaskar.
Dear audience, now let us begin this engaging discourse. Our topic is empowering women's choices for childbirth. Dr. Janvi, from an academic career in public policy and economics to founding a midwifery center, how did this transition take shape? How did your personal experiences during pregnancy inspire you to establish the Astrika Midwifery Center?
Yeah, thank you. Thank you so much. So, as I was mentioning, my profession is in public policy. I focus on public health now, especially maternal and child health. So in 2016, when I was a PhD student at Harvard, I was doing my field research in Karnataka. So I was doing a randomized control trial with 1,600, 1,500 bus drivers. And therefore, I was sort of shuttling back and forth from Harvard and Bangalore in terms of during my pregnancy. I was there for part of every semester, and then I was here and there. So I think the differences in the quality of healthcare in the US and what I was able to find in Bangalore were very stark. I really struggled to find evidence-based care in Bangalore, where care is, as per clinical protocols, as per guidelines, where providing top-notch healthcare was a little difficult to find. And in some ways, maybe it's an unfair comparison, like to compare Harvard's hospitals to, but I feel like India is at that stage where we can very well aspire to be on par with the global best facilities, and we should be aspiring to be on par with the Harvard hospitals and so forth. So I think through that own process of my own pregnancy, I ended up doing a fair amount of research in this space and got a lot more knowledge about maternal and child health in India. And that's when I graduated in 2018, and then in 2019, I founded Astika Foundation. So at Astika Foundation, we work on three major goals. The first is reducing infant and maternal mortality. So we have a lot of programs on that. We do a lot of capacity building. Usually it's in partnership with state government. So, Uttar Pradesh, Bihar, Madhya Pradesh, these are all states where we work in government hospitals and so forth. In fact, and we've also, I think we have partnered with the Manyata initiative of Fogsi, which is one of the important quality of care initiatives that Fogsi has put out. So it's been very, a privilege for us to partner with you on that, with Fogsi at large on that. We also are the partner for Government of Karnataka on the professional midwifery cadre. So in December of 2018, the central government introduced the nurse practitioner and midwifery credential, the same way there are nurse practitioners in critical care. So this is a cadre of BSc nurses or GNM sometimes who would have finished additional 1.5 to 2 years of specialized training in intrapartum care, prenatal, postnatal as well, the entire pregnancy journey of the woman. So we run a National Midwifery Training Institute at Vani Vilas Hospital in Bangalore, which is Karnataka's largest women and child hospital. We run state midwifery training institutes in Belgavi and in Mysore at Cheluvamba Hospital, I believe is the oldest in Karnataka in maternal health. And we also do a fair amount of advocacy work from Astika Foundation, and advocating for the needs, these things to improve. So one, of course, is the infant and maternal mortality rates, but we also work on reducing over-intervention. That high rates of C-sections, inductions, augmentation, episiotomies, and so forth, they cause a fair amount of morbidity to the mother and child, including instrumental deliveries, vacuums, and so forth. And, our philosophy is kind of that we should be India has grown enough in maternal health that we can afford to not think only about mortality, but also about morbidity. Of course, in the past, it was far more important to focus on infant and maternal mortality rates. But partly because we have made so much headway in those spaces, it is, as a country, it is time as a public policy matter to start focusing on quality of care. So we work on that. And also we do a lot on respectful maternity care. That physical abuse, verbal abuse, lack of informed consent, lack of privacy, lack of confidentiality. I'm sure many of the people listening to this podcast would have seen or heard all of that in medical college. But those are not best practices, right? Even Lakshya and the other government policies now are to promote respectful maternity care. So we work in partnership with a lot of the medical colleges and so on to train nurses and other staff in how to provide respectful care to the mothers. So that is high level what Astika Foundation does. I set up Astika Midwifery Center in 2021, small birth center in the private sector. It's inside a larger hospital in Bangalore. And that is, to show, ethical evidence-based care in practice, to kind of demonstrate how it can work in a Bangalore context, and even to discover how can we make it work. So that's the overall story.
So yeah, that's great. I think I have been to my Vani Vilas Hospital and had a look at your center as well. So
nice.
Personal experience of the whole ambience it offers women, those going for childbirth are always a little bit afraid. They're apprehensive. What is going to happen? So all these things are very, very important. And I think you're doing a great job. It's almost 5 years, I think, you have been into this field now. And I've been following you on Insta as well. The type of awareness you're creating regarding childbirth and choices. That's so important.
Thank you so much.
I think there are a lot of misconceptions and a lot of challenges surrounding these health rights, especially in childbirth in India. There are a lot of things, women, especially of underprivileged background, even those who are in the upper class, they also have these, misconceptions. So what do you think these women's health rights in childbirth, how these misconceptions work? What are the challenges according to you?
So I think one challenge is that patients in general, and this is not just in maternity care, generally are not very aware of patient rights. Though actually the patient rights are actually put up now in every hospital, NABH and all requires a lot, but still people don't have that really, they don't take it. I mean, the culture is not necessarily there in our country yet, that patient rights is a strong aspect and that we have to honor the patient rights. So for example, if we look at consent processes, definitely I think that hospitals have become quite diligent about taking consent from the patient or their family. But still, I would say informed consent where the patient understands enough to be able to take that choice is a little lagging, right? If I compare to the US or UK or whatever, typically there's a fair amount of pamphlets or other material for consumers so that they can understand and then decide. Here, what happens is I think we have not made that understanding very easy for clients and for patients. So they rely a lot on what the doctor tells them and then they go with that. They don't actually end up exercising their choice or their rights. So I don't have a solution for that really. I think as India continues to develop, as the healthcare facilities continue to develop, we can already see that change, that at least the more educated population is, trying to understand the whole healthcare, trying to take choices. Even in areas like, right to die with dignity and all, you're seeing some of these things of advanced, directives, living wills, all of that. So I think some of these things are very much coming into play now, but still I would say India is lagging if I have to look globally. In terms of misconceptions, I mean, I would say this is foremost, right? I think people don't understand that they have a right for refusal, a right to refuse treatment. Very few people exercise that right of refusal. They will go with the flow and not really. So therefore, it's like they give the consent, but usually there isn't so much of a choice or a discussion. It is a more procedural matter of the consent. So I think these are some of the, I wouldn't say exactly myths or misperceptions, but some of the areas that we need to focus on collectively in public health.
Yeah, so very important, I think, as you rightly said, not only in maternal health, not only in childbirth, but sometimes I find in rural India that consent is taken, maybe the person doesn't understand what consent they have given and what they have signed off. And it's so very important, especially in context of childbirth. And yes, in that same context, I think respectful maternity care, again, a very important aspect of maternal health. But in Indian context, that has started building up with Lakshya and its initiatives, what Government of India is setting up. But still, do you think, how do you see respectful maternity care in India, and how do you identify it as a crucial aspect in improving maternal health outcomes?
Right. I think, as you were saying, there has been a lot of policy work, Lakshya, but also Suman, even before that, a lot of the policies from the health ministry in the last 10 to 15 years have really focused on respectful maternity care as a key component of quality of healthcare. And respectful maternity care involves several things, right? One is exactly as we're discussing, genuine informed consent, where they understand enough to be giving the consent, not just giving it in general. So that is one. But also, speaking respectfully, I think is important. I do think that a fair amount of, physical abuse is still happening. It is much, much improved, but pinching, hitting, slapping in labor rooms still very much is happening, especially in underprivileged settings. It is far, far better than 20 years ago because of all these initiatives like Lakshya and so on. But it's not very easy to bring in cultural change. So that is still perhaps taking time. I think verbal abuse is still very common. Like, why are you shouting? You shouldn't, like, just generally, like, harsh language towards mothers. And because mothers are very vulnerable in that moment of labor, the person in authority, if they use that kind of very harsh language, it has quite a psychological impact on the mother, which is also not good for labor, right? Labor stall out in atmospheres of such high stress. So ensuring, that mothers' natural oxytocin levels are high and that you won't have to end up augmenting oxytocin that is one function of respectful maternity care, right? To give an atmosphere for birthing where the mother feels confident and relaxed and is able to progress. So I would also add that I think there are three major reasons that for best practice healthcare, we should be emphasizing respectful maternity care. Firstly, I think it is a human right of people to be treated well in healthcare settings, whether it is in a government hospital, private hospital, you're wealthy, you're rich, you're not, you're impoverished. As a public health system, we in India should be striving that every individual, every Indian citizen of ours is treated well in the healthcare context. So it's important in and of itself. Separately, creating those kind of atmospheres will help labor progress and generally help into having better birth outcomes. And then finally, especially in areas where there's still a lot of institutional deliveries, still a lack of institutional deliveries and a lot of home births. I'm thinking more often in tribal areas and so forth. One of the reasons there's a lot of resistance to coming and delivering in a hospital, even though it may be life-saving for you or your child, is that the way they are treated is so harsh in the hospitals that they'd rather take their chances at home or with the local midwife, dai or whoever it is, traditional birth attendant. So I think even for that goal of trying to ensure that institutional delivery is more or less 100%, that even in the more underprivileged populations, they are getting access to hospitalized, deliveries. It is important to ensure that respectful maternity care is a norm across the country.
Yeah, I think we are making headways into this. We do have the respectful maternity care plays now training going on in various medical colleges, public institutions as well. We are finding birth attendants being allowed inside the labor room now. So things are changing, I think, but still it's a long way to go, but I think it's very, very important that we continue this improvement, the quality improvement processes in our labor rooms, in our institutions, in our private settings. So all this is really very, very important. I think your center is one of the center which emphasizes all these ethical and evidence-based shared decision making. How do these principles, what is your experience? How do they impact the outcome and the success of the childbirth in your settings?
So, yes, just to close out with that, you're completely right that, the provision of respectful maternity care has improved dramatically, for sure. And that's what a lot of our work is. So, we collectively are having impact. I'm so happy to hear you say that. Coming to Africa Midwifery Center, our private center, right? We have put a lot of effort into training each and every staff member. First, recruiting good people who have that personality that they kind of care about being compassionate and women-centric. And after that, doing quite a lot of training so that each mother who comes to our hospital gets that kind of empathetic, women-centric, respectful care. So what we have found is that, it yields huge dividends. One of the reasons that we have grown quite fast as a hospital and that people refer to us, people come back to us, they send their friends, family, cousins, is because this kind of very patient-centric, mother-centric care is hugely appreciated by clients. So I think just from a perspective of success as a private maternity hospital, it has definitely helped us. This kind of treatment of mums, even from pregnancy onwards, also builds a lot of trust in the clinical team, right? There is a two-way relationship built. And one of the things we've really observed is that births go much smoother, labor progress is much better, stalls and all are much less common when there is a mutual trust, right? If the doctor is recommending something, the client trusts that the doctor will not unnecessarily recommend and they agree also. Or that, even we as a healthcare provider trust that the client is being disciplined. If they have GDM, they're actually taking their medicines. If they're, the exercise, diet, listening, following guidance, right? When there's a two-way trust built up, then outcomes are benefited partly because healthcare delivery is a lot easier. Both giving advice, the person implementing, all of that improves. So these are sort of the two things we have felt that respectful maternity care is really helping us, both in terms of building market share, but also in terms of delivering good outcomes. And of course, client satisfaction is very important.
Yeah, I understand this sort of feedback is so satisfying, from our clients, our patients, the successful outcomes, maybe not just vaginal births, but those satisfying births where the patient finds it so comfortable to go through that labor. Do you want to share any particular story of an individual where she found birthing so difficult and she came out to be, happy? Any story you would like to share with us, if you can identify?
Pretty common story that, a lot of people come in scared. Now, of course, we do C-sections and all as well, not to say that we don't. But even in a C-section, giving that kind of compassionate, respectful care is very critical. Right? It's not that is for normal deliveries. No matter what your intervention is or what you're being treated for, you should be treated in that manner is our approach. So I think here is where let me touch upon midwives, right? As I was mentioning, Astrika Foundation trains professional midwives in government hospitals. But Astrika Midwifery Center, a private hospital, employs midwives. They were all trained at Fernandez Foundation in Hyderabad. Some of you may be familiar with Dr. Evita Fernandez. So they're all graduates of that college program there. And they are really skilled. So in our hospital, we don't have any junior doctors, duty doctors or registrars. We have midwives who handle intrapartum care, consultants who are, of course, taking the decisions, guiding and so forth, right? As part of a team approach. So a midwife has that skill of giving continuous 1:1 intrapartum care. She is able to, of course, monitor the baby and mother closely, but also able to give that lady confidence, pain relief, emotional support, all of which really makes a very huge difference. So a lot of clients who are scared, once they get into labor, they always say that thanks to the midwife, I was able to do it because she guided me and mentored me and held my hands throughout and gave me that motivation that I can be strong. And of course, we offer every type of pain relief. Our position is definitely that pain relief is something you should go for if it's going to suit you. So of course there is that, but even if people are on epidural or whatever, there's still, I think, a lot of psychological anxiety, and having that team approach plus the midwifery approach has really helped us with that.
Oh, that's wonderful. I mean, I think that even obstetricians in medical colleges should be trained in this midwifery, the skill, so that they are able to support, and of course, a collaboration is very important. The collaborative care between an obstetrician and midwife to support and have that very, satisfying, we must say, the birthing experience. That's so good. But there are challenges, I think. Most of these challenges are systemic challenges, preventing India overall, the way the system works in the Indian settings. There are challenges, especially as far as childbirth is concerned, accessing quality maternal health care is concerned. So do you think this collaborative care between an obstetrician and a midwife and the type of, the programs coming up now for collaboration, how would this help, especially for the underserved population? These challenges, the barriers, how we can overcome them and how the collaboration can work together.
So I think in underserved populations, having this midwifery cadre helps in two ways. One is you just sort of end up with more healthcare providers, right? Not always, because sometimes the staff nurse becomes a midwife and that staff nurse role is not filled. But at least in maternity, you will have a better, larger and more skilled workforce. So where we work, right, places like Vani Vilas has 18,000 deliveries a year. It is very over capacity in many ways, right? So in these large government hospitals, large medical colleges, just having more hands is itself beneficial. And because they would have gone through 1.5, 2 years of training, they are very skilled, right? They are genuinely able to handle births to quite a degree. The thing is that an obstetrician is never going to be able to sit with a mother for 12 hours. It's not possible. Bringing in a midwife who gives that continuous one-on-one care enables the obstetrician to both focus on high-risk care, focus on gynac, focus on where you really need an obstetrician skill and not the mundane sort of thing which is not needed to be done by obstetricians. So having this complementary cadre can really benefit how a hospital runs as well as the obstetricians themselves. When somebody who can trust for monitoring is handling end-to-end, then the demand on your time is much less and you are also able to give a longer trial of vaginal birth, a longer induction, and generally to be able to have that patience without burning yourself out, right? Otherwise, it is not feasible without somebody like that on ground.
I think you're right. I think the residents would also appreciate it, the medical colleges having 20,000 deliveries per year. So how much amount of work is there? So residents also, I think, would appreciate that additional hand, the skilled hand, the counseling, the consoling, the affection which is needed during childbirth. Because we are running around so much, going to the OT, managing those high-risk cases, doing those surgeries. We really appreciate this kind of collaborative care which is coming up and this cadre coming up. I think we should all, make as obstetrician, I think, and as residents also, because sometimes it happens that is this a competition? It is not a competition between an obstetrician and midwife. It is a collaboration. It's a positive collaboration which we should all, take advantage of. Now, another question which comes to my mind is about women's health right or to choice of maternal health. Do you think education and some awareness drives, would help to create awareness about these childbirth rights in the community at large? Is it important that we educate the community as well?
We do in Vanivilas, right? And that is a very underprivileged population. I'm talking in that context. We do a fair amount, both through pregnancy, like awareness classes during pregnancy, posters, pamphlets, all of the above. I would still say it is a little difficult in such populations to really focus on awareness. They also have many like countervailing challenges, right, which they have to deal with. But I think that awareness building is needed. But what I feel is that when mothers experience this kind of care, right, government hospital, then they go home and tell their communities, and that is how awareness spreads. Like, awareness campaigns, posters, in the end, it has limited effect. One mother who has come to a government hospital and had such a good experience in the midwifery unit will go back to a whole community and say, it is this much the government hospitals have improved. This is the quality of care. I don't think you need to, you should not feel that you can't go, or that you should find a nursing home, or that or in some cases consider home birth, whatever. So those things automatically build awareness. When people hear these kind of positive stories of government hospitals, that ends up building awareness in the communities.
Yeah, that's great to hear. Another question which comes to my mind is about training. People need training in this kind of midwifery skills. So how does Astrika come in? How is your team able to train other people in the state or in the other cities as well?
Done through Astrika Foundation, right? A private hospital doesn't do any training. So Astrika Foundation, when we say we run the National Midwifery Training Institute in Bangalore, we mean that we employ international midwifery faculty. They are currently all from Europe. So European midwifery faculty come to Bangalore at Vanivilas and train Indian midwifery faculty. So midwifery educators. So everybody there has to have at least a BSc nursing. Usually they have MSc OBGYN and they are basically nursing professors. And they undergo an additional 1.5 years minimum, but sometimes it's going up to 2 years of training, specifically in midwifery and being a midwifery faculty. So in the state midwifery training institutes I spoke of, which include Bangalore, Belgavi and Mysore as of now, these Indian midwifery educators train what are called NPMs, nurse practitioners in midwifery, right? And they're supported by our international faculty. So our international European senior faculty will mentor the Indian faculty at least for some more years. So in Mysore and so forth, this is how it works, that the government, and this is currently more or less a government program, right? Almost every student is already a nurse in the Karnataka Health Department, the health services. So once they have finished their 18 months of training, such as in Mysore, we have finished 1 year and like 6 months of practice is left, like the internship phase. The idea is that they go back to their district hospitals and are able to bring in that midwifery-led care in the labor rooms and create that bandwidth in, say, a Hassan district hospital or whatever is the local district hospitals. So this is how the resources of the local hospitals become enriched, right? And then they can better serve that community. So basically our training model is a cascade training model with a full 1.5 years of training, of which, most of it is in person. Some of it may be long distance mentorship where they go and practice in Hassan, but they are being mentored long distance. That is the internship phase. The actual studying phase is fully in person. And even in the studying phase, they need to complete 40 births. There's a lot of requirements that has been set forth, and full credit to Government of India. A lot of this has been, the curriculum is from the central government. The scope of practice has been approved. So a lot of work has happened for this, nurse practitioner and midwifery cadre. And yeah, that's how we train, is in this cascade model of 1.5 to 2 years. It's a full degree program.
Okay, but I think the private setup as well would love to have this setup. This is presently going on in the large public health hospitals.
Yes.
I'm from Maharashtra, in Wardha Sevagram also. Yes. This is being taken up as a great initiative. However, I think we do need some more training for maybe the private institute, and I think we have to work in something of that sort, because 50% of the care for mothers is being given in private setup, as you rightly know, and that's why I think Astrika is providing a lot of this kind of quality care for private setup as well. So I think there we can work in something where Astrika can come in, with some courses, maybe online, and some part could be a hybrid setup where we can have that kind of
For
private.
sure.
Yeah.
That's actually already one of Astika Foundation's offerings. So we do for institutions, we do workshops in things like respectful maternity care, evidence-based care, alternative birthing positions, and we have a syllabus. I mean, we have a set of courses. So for example, we've gone to AIMS in Delhi. We have gone to Loni in Pravarana in Maharashtra. And yes, we are very fond of Sevagram in Wardha, Dr. Poonam Shivkumar and the whole team who are doing really excellent work in Maharashtra. Or to MS Ramaya College in Bangalore. So we do this actually quite a lot. And if anybody listening to this podcast would be interested, just come on to, astrika.org, aastrika.org. If you reach out to us, we are very happy to do workshops for others like as per need. And we also aspire within 2 or 3 years to set up a private midwifery training program. Because in every batch we're doing with the government, we are putting 3 of our candidates to become future faculty for a private midwifery training institute, Astika Midwifery Training Institute. So that is something definitely we see as an aspiration, because I think midwives will add a lot of value in the private sector also. The private sector has kind of, maybe it's not so under-resourced for sure. It's not like that you cannot have nurses or registrar doctors. Those all exist. It doesn't have the sort of really low staff to patient ratios that you might find in the Vani Vilas. But at the same time, in the private sector, there are many other pressures, including financial pressures, insurance companies. Like there are a lot of other reasons that are driving, not as good quality of care as maybe a cadre of midwives can bring in. So that is something we want to do either next year or the year after. And we would like to put together a batch of 10 to 15 candidates who are sponsored, right? Because it's an 18-month program, so it is quite expensive. But, hospitals who might be willing to sponsor 2 of their long-time nurses as becoming midwives with some bond or some commitment for 5 years. That is certainly something we're interested in, because we see that as important for the long run, and we are in fact working on it. And anybody, who's keen for this also, please just contact us on our website, Astika Foundation's website.
I think that's very important. I think the audience listening would find it really helpful. So Astika Foundation does have a lot of courses. I have completed few of them, I think, with Astika and Nationwide Quality of Care Network. Yes. I am also a member of that. So we do find your training on respectful maternity care, I think one of the courses which we can join. And of course, for the physical part, you really need to go and train yourself physically only. So that's very important, I think. So
yes, I think our physical offerings have some costs associated, but all our digital courses, you just have to create a login and you can avail of anything. And it is from prestigious partners, right? Now, NQOC, and as you spoke about, the Quality of Care Network, Japago has courses, Maternity Foundation has a lot of courses. So, I'm pleased that you also have seen some of them. So if you are more oriented to doctors, like the quality improvement one, most I would say are for nurses, but in your institutions, if you want to get your team trained, this is just free of cost. You just send them to log in, and definitely I think some exposure and learning can come, and it's worth it since there is no cost, right? You just have to sort of get them through it.
I know I'm at Amravati Medical College now, and I will specially invite you to have a look at our labor room and try to bring in those skills, and various aspects of respectful maternity care and sort of midwifery, collaborative care or skilled care in our setup as well. So thank you very much for offering that. And I would just like to come into this. We are now coming to the end of our podcast. I would just like to ask you a question regarding the maternal health care system. Is it moving in the right direction in India? What do you say? And what more we can do apart from what we have already talked about?
At a high level, definitely yes, right? The degree to which maternal mortality rates have come down, infant mortality rates have come down, institutional delivery has picked up, quality of care is a lot better. Whether it is the drug reaching the PHC in Bihar, or whether it is referral services, or whether it is availability of NICUs in rural areas, I have no doubts that quality overall. Last 20 years, I think there has been humongous progress. No doubt, we're on track for the SDG 2030 goals also. I think everybody should acknowledge that it has been, whether, so many involved parties, whether it's the government, whether it's Fogsi, whether it's individual doctors and professionals and, hospital management and nurses and so forth, and of course, a lot of governments and NGOs. there has been a whole of society sort of effort for this. And definitely, I think it is on those matters very much on the right direction. Similarly, I would say with respectful maternity care, for sure, I think it is much improved. And I think now everybody recognizes it's needed. So in some places, maybe implementation has not yet happened, but there is consensus that this is something that has to be done, right? In private, public, all types of hospitals. So that also is a lot of progress. I think one area where we perhaps are going in the wrong direction is in our use of interventions. That very, very high intervention rates are quite common. Like private sector, for example, West Bengal, Telangana, Jammu and Kashmir, the private sector C-section rates at the state level are more than 80%, and this was 6 years ago. 80, 90, 70, 60% is in private sector is common. In Karnataka, there are so many districts which have 60 and 70% C-section rates in private sector. And all this is from the last NHS survey, which honestly, it's been a while now. It's been 5, 6, 7 years since we had an NHS survey. Even from what you hear colloquially, from what we have heard from government officials, etc., those numbers are very, very high, especially in certain states. So this is creating one is it's creating a lot of morbidity for mothers. It's also not an optimal use of resources, right, in a public health system to have such high usage of surgeons and surgery. And there are a lot of factors affecting that. But definitely, I think that is one aspect which I do feel is consistently getting worse. That not everywhere. I think places like Andhra and Telangana have actually turned the tide where they are very focused on quality of care, even when it comes to over-intervention. But most states, most part of India, I think that this is kind of getting worse. You see, there's many reasons, one of which it becomes culturally normalized, both among medical providers and clients, that birth will be a very medicalized, very interventional approach. I think that from what I've learned, that in a lot of the medical colleges, especially the private ones, it's sometimes a struggle to get enough volume of deliveries that your students can really be trained in every aspect of normal delivery, in every complication, become really confident with the unexpected breach, a shoulder dystocia, whatever might happen, right? So those volumes sometimes are hard. You need really high volumes to be able to properly train on such things, which is not always easy. Of course, there are a lot of financial, operational, and insurance factors driving high intervention rates, for sure. I think we should not forget that. And then, like obstetricians need to have that work-life balance. It is not possible. They're not machines, right? It is not possible. So if we have to create, for example, lower C-section rates, you need solutions like an obstetrician and a group practice, or it's an institutional practice with shift duty, or that the midwives are at that skill level where the doctors and feel burdened. Like there are solutions for this, but in private sector hospitals, as of now, it's a very individualist approach where it's usually one doctor and right? Like if I see somebody throughout my pregnancy, I expect that person to be there at the delivery. So when these are the sort of cultural expectations from clients, it's not feasible to have low C-section rates. So getting to, evidence-based care where interventions are done only for clinical reasons, but not for financial and operational reasons, I think that is one place where we are getting worse, where that commercial pressures and all is getting worse on doctors, not better.
I think we need to, from your discourse, I think two things. One is the constructive one, applause for all the faculty, the gynecologists, the obstetrician working throughout the nation to bring the maternal mortality down so much. That's one thing we can applaud. Second thing I would just like to share with you about the optimizing C-section project of Fogsi, which we have been doing over the last 3 years. We have 50 maternity units across India. These are large hospitals, private medical colleges, government medical colleges. 50 such centers across India are working on the C-section audit, first of the thing. Secondly, right. We are also working on, other practices like induction of labor, then labor analgesia, and respectful maternity care. These 4 things we are building into it. Since last 3 years, we are working with first Dr. Rishikesh Pai, then Dr. Jaideep Tank as president, and now Dr. Sunita Tandulwadkar as president. So we are, on track, I think, when you're talking of auditing, and we are changing some practices as well. So I think we are all weaving in together to, bring those things down, and especially as you talked of, optimizing C-section rate optimization. Where it is needed, we should provide, and where it is not needed, definitely the interventions have to come down.
Optimization. No, and I think you raise a fair point, and actually I agree with you. I think even on optimizing of interventions, the bigger institutions and medical colleges, there actually is a fair amount of both effort and progress. In fact, we work with a lot of such large institutions. When I meant that the pressures on doctors are getting worse, I was more thinking of it in terms of, an independent obstetrician who's running a small facility, or the solo, or has her own hospital or own nursing home. I think for them it's getting harder, not easier to, but that has been my experience just talking to people, that the pressures on them to is higher than 20 years ago, and that it is a bit of a struggle. But I'm with you. I completely actually do agree that in the institutions, medical colleges, even on this aspect, I think things are improving. There is a lot of effort on quality improvement. As you know, we do a lot of work with National Quality of Care Network, NQOCN, because, and then we partner with, I don't know if you've come across ICI, the International Childbirth Initiative.
Yes,
there are many, we are also in that system. There are many Indian hospitals who are really trying for quality improvement through that process. Even Lakshya, Manyata is an excellent example coming out of Fogsi on quality improvement. So I actually do agree with you that both attention is a lot more, and there has been at least some progress. But I think at least for the individual practitioner, maybe we need to support them more.
Yeah, and this project, it is led by Clinical Research Committee of Fogsi. It is called Vishesh, because we want to give a lot of importance to this aspect, where even, the obstetricians themselves want the interventions to be reduced. So, yeah. And lastly, from your side, I want you, if you want to give a piece of advice to expectant mothers, we talked about obstetricians. What about these mothers? What would that advice be to these expectant mothers?
The only advice I always give them is that as consumers, you have to go out and seek good care. It is when that mothers demand it, that the hospital system feels that, can afford to invest and really focus. When we know that all efforts at quality improvement are helping when it comes to clients and client satisfaction, for us also that positive chain gets built. Right? So go out, seek good care, look around, see who's doing really well in your neighborhood, who is putting the kind of efforts that Professor Surekha is talking about in terms of quality improvement processes. Even from the client side, I think appreciation for those who are trying very hard, and you going out and researching and choosing the best centers in your locality will go a long way.
Absolutely, I think, and what would drive now future medical care, the future nursing homes, I think. Yes. They should also be coming up with things which the consumers are demanding, isn't it? When the demand comes from the consumer side, it would be, a quality improvement is bound to take place, isn't it?
Exactly.
So thank you very much. I think that was a very, very beautiful message from your side. And yes, as we conclude the insightful episode of Gyan Pravah, I extend my heartful gratitude to you, Dr. Janvi, for sharing your expertise, not only your expertise, but sharing the critical need to empower women's choices, especially in childbirth. Your dedication to improving maternity care, your advocacy for respectful and evidence-based care, it is truly inspiring. And I would like to specially thank our Fogsi President, Dr. Sunita Tandulwadkar. Her visionary leadership has made this platform. This platform is there for all of us. It is transforming education, it is transforming action, and bringing meaningful change in women's healthcare. So I would like to thank both of you, Dr. Janvi, a very young, as rightly said, young philanthropist, and Dr. Tandulwadkar on the other side. So two of you together are such an inspiring duo. So thank you both of you, and of course to our audience. Thank you for tuning in, being part of this journey. Your engagement and commitment to advancing maternal health drives us and takes us forward so much. So stay connected for more thoughtful discussions in the upcoming episodes of Gyan Pravah. Until next time, let's continue to learn, to share, and to empower. Good evening and take care. Thank you very much. I, Surekha Taire, would like to sign off. Thank you.